Friends, welcome to Ezinurse, where nursing education made easy. So in this session, let's discuss regarding the first and the second sem and the most repeated and definitely appearing questions of the nursing foundation. So let's get started. Coming to our first important question is, what is infection and also the different infection chain? So what is infection basically? It is the invasion of the and multiplication of the pathogenic microorganisms. It's just invasion in the sense if any microorganisms is entering a human body and also it tries to multiply inside our human body, and you can see it might be any kind of microorganisms, for example bacteria, viruses, fungi inside our body, where it is leading to the tissue damage and illness in that person. And this process of invasion and multiplication of these microorganisms is called as infection. So let's see what is the chain of infection. So how it spreads. Firstly, the infectious agent, the pathogen, as I just mentioned, it might be any of these like bacteria, virus and fungi. They cause the infection. So they invade. So these are the infectious agents which is causing the infection. Coming to the second chain is the reservoir. It's nothing but the reservoir is the natural habitat where the infectious agent lives and also multiplies. So our body, for example, this is a pen. This also can be a reservoir wherein which the microorganisms are placed. So if this is infected and we are holding this pen, then the infection spreads to us as well. Human body, animals and surfaces of non-living things. So these becomes the reservoir. Coming to the third point is a portal of exit. So from one person to another person, how it is exiting the microorganisms, the path by which the infectious agents leaves the reservoir. How it is leaving? Through the respiratory tract, through the bloodstream, through the skin, etc. In case of human body and animal's body, these are the portals of exit of these microorganisms. The next chain, we can see the mode of transmission. How it is spreading from one person to another person or from one non-living thing to another person. It may be the way the infectious agent is transmitting to the new host. It might be through direct contact, airborne, droplets or vectors. It can be through direct touch. So it can be through the airborne transmission, droplet transmission. So if you are speaking and the droplet from your mouth has the infectious agent, then if somebody else is inhaling it, so that becomes the droplet mode of transmission. So these are the examples for mode of transmission. So the next, you can see the portal of entry. How these microorganisms enter somebody else's body. Firstly, the route through which the infectious agents enters a new host. Example, through the mucous membrane, through the broken skin, if there is any wound or injury, through that as well, these microorganisms can enter the new host. And respiratory tract, through the infected air. And the last, you can see it's susceptible host, who are very much susceptible to these kind of infections, especially an individual who is at a risk of infection due to the factors. Who is most susceptible? You can see weak immune persons, old age and most young age, infants, young age as well as the old age people, they are more susceptible. And underlying health conditions, if they are having any health issues or disorders of health, then they are the most susceptible individuals or the host. So this is one of the chain of infection, and this question may be asked for a 5 marker and sometimes it can be clubbed with the other questions for a 10 marker. The chain of infection. Next, let's move on to our second question, that is sterilization. What is sterilization? It is a process that eliminates or destroys. It is eliminating and destroying all the forms of microbial lives. So as we just studied, microorganisms, it might be bacteria, viruses, fungi, parasites, etc. So here it is eliminating or destroying these microbial life, including, as we just told, bacteria, virus, fungi, and their spores, in the sense the offsprings of these microorganisms. So typically through the methods such as heat methods, chemical methods, as well as the radiation methods. This process of eliminating these kind of microorganisms is called as sterilization. So let's see which are the different types of sterilization processes. Coming to the first one, dry heat sterilization. It means high temperatures for about 160 to 180 degrees Celsius. It is destroying the microorganisms by oxidation over certain period of time. That is, extreme temperatures are given to kill the microorganisms. That is dry heat sterilization. Coming to the second type is the filtration. Filtration in the sense it removes the microbes from the liquids or the gases by passing through the filters with microscopic pores. So there are small microscopic pores in these filters wherein which liquids and gases are being removed by the microorganisms, and that is called as filtration process. Coming to the third one is flaming process. That is, they are exposing directly to the flames in order to sterilize the small metal instruments. How? By burning the microorganisms. They are flaming it. They are burning these kind of microorganisms. They are burning these kind of metals, small metals, and removing the microorganisms. The next process is radiation process. What it does? It uses ionizing radiations like gamma rays. So these are the rays which are used in the radiation processes to sterilize the heat sensitive metals by disrupting the microbial DNA. The DNA of the microorganisms are disrupted. What they are done? They are disrupting these kind of microbial DNAs and they are decreasing or killing the microbes with the help of these radiations, for example, the gamma rays. Coming to the next method is the steam under the pressure. It's also called as autoclaving process. Here, high pressure steam. For example, 121 to 134 degrees Celsius, it is used to kill all the forms of microorganisms as well as the spores. Here, even the offsprings of the microorganisms, the spores, the eggs, they are also killed in the autoclaving process. It is a device. What is autoclave? It is a device that applies the steam under the pressure for sterilizing the equipments and the supplies, especially in the medical settings. We are using this autoclave machines. So the next process of sterilization is moist heat sterilization. So here it uses hot water or steam. Here, without any kind of pressure, they are using hot water or steam to denature the proteins in the microorganisms. So inside the microorganisms, they contain certain kind of proteins. So here they are denaturing it. It will not be useful for the further multiplication. This is how they are killing the microorganism using the moist heat sterilization. So the next process is drying or desiccation. So what is this? It removes the water from the microorganisms and inhibits their growth, but they may not kill all kind of organisms. It's just the surface. You can see they are removing the water only from the microorganisms, inhibiting their growth. It is not killing all the microorganisms, but they are reducing the growth of these microorganisms in the drying or desiccation process. And the last process is pasteurization. Here they are heating the liquids, especially in case of pasteurization, they are giving the example of milk. How? At around 63 to 72 degrees Celsius, they are heating these liquids for a short period to reduce the microbial load. In the sense, there are thousands of microorganisms. By pasteurization, they can reduce the number. The load of the microorganisms is decreased rather than killing the complete amount of microorganisms in the pasteurization. So these are the different types of sterilization process, which is also one of the most important question for a 5-marker. Let's move further for our next important question, that is the health illness continuum. First, let's see what is the definition of health. Health, it's a state of complete physical, mental as well as the social well-being, and not merely in the absence of the disease or infirmity. As we all know, the health definition is a complete health. Not only physical but also mental and social well-being is called as a healthy person. And let's see what is illness. Illness is a poor health resulting from the disease, injury or an imbalance in the both physical and mental functioning of that person. So a person is considered ill if he is having any disease or injury in his body, and there is also imbalance in his physical and mental functioning. Only then he is called as ill person. So what is this concept of health and illness? So it says it is representing the dynamics and fluid nature of the health. Health, sometimes it's very good for few people and it is very crucial, or chronic illnesses are seen in some people. So it is something, the fluid nature of the health. It is illustrating a range between the optimum wellness and the severe illness. As you can see in this picture, there are two different sides wherein which you can see the most disabled person, that is the most chronic illness he is facing, and also high level of wellness, that is he is much more healthier. So there are two different arrow marks which is given here, where you can see two extremities of health, the most healthy person, the most ill person. So this is the concept of health illness, the continuum of health illness. So let's see what all comes under this. So wellness, the first point that we are discussing regarding the health illness continuum is wellness. Here, the highest point of the continuum, as I just told you, this is the highest level of wellness and the highest point of this health illness continuum. It is representing the optimum physical, mental and social well-being. He is completely healthy person. Coming to the second point, good health, it's a state of a person where you can see generally healthy, but sometimes, occasionally, he is experiencing small health issues, minor health issues he is experiencing. So he is called as good health. And the next we will be discussing the normal health. There is a balanced state where a person is experiencing typical levels of health with no major concerns. In the sense, frequently he might just get ill for 1 or 2 days, but ultimately there are no major illnesses that he is facing. So it is called as normal health. So this is the third point. Coming to the next point, we are discussing the mild illness. In the sense, the person, minor health problems such as colds, mild infections that is causing temporary discomfort. Temporarily he is discomforted because of these mild illnesses he is facing in his life. So that is the fourth, step of illness, you can see. The fourth step in this health illness continuum. Coming to the fifth point is a chronic illness. There is persistent health conditions or diseases that is very much impacting their daily life, as well as it requires an ongoing management. So it is impacting his day-to-day functioning in this chronic illnesses. Coming to the next point is severe illness. It's a state of serious disease and disability. He is unable to, move from one place to another place. He is disabled to do his daily activities, and there is extreme serious diseases is seen. The person's ability to function is being impaired. He is unable to function by himself. It has been impaired. And the last or the worst case is the death. It is the farthest place or the farthest point on the continuum. It is representing the end of life where the body can no longer sustain itself. Our body cannot sustain itself and it leads to the last point on the continuum, that is the death. So this was the different levels in the health illness continuum. So let's move on to our next important question, that is hospitals, its types as well as its functions. So let's see, what are hospitals? These are a healthcare facility which is usually providing the comprehensive medical, surgical as well as the therapeutic services for the diagnosis purpose, for treatment as well as the care of the patient. Why will a person go to the hospital? If he is having illness, he is going to be cared over there. He will be identified with whatever disease he is having, and obviously they are diagnosing, treating and caring those patients. So that institution which does all these functions is called as hospital. So let's see, what are the different types of hospitals. Based on the ownership, the hospitals are divided under public hospitals and private hospitals. Government owned and funded hospitals are called as public hospitals, and owned by individuals or certain kind of organizations, it is often for the sake of profit, then those kind of organizations are called as private hospitals. So the second classification is based on by specializations. So for example, we tell there is an ophthalmic clinic or dental clinic. According to the speciality, they are dividing these hospitals. So general hospitals means they are providing a wide range. So all kind of diseases are being treated. Wide range of medical services for various conditions is given care in the general hospital. Coming to the second classification, specialty hospital. Here they are focusing on specific areas like cardiology, orthopedic, pediatric in the sense they are taking care of children, orthopedic related to the bones they are treating, cardiology related to the heart, the specialty hospitals. So the next classification is by the size. Small hospitals in the sense typically they are having lesser than 100 beds, and medium hospitals they are having between 100 to 500 beds, and large hospitals they are having more than 500 beds. So this was the third classification. Coming to the fourth classification, by the service they are giving. What kind of service they are providing? Those hospitals are providing. Teaching hospitals, they are associated with the medical schools. Many of the hospitals, they have their own medical schools wherein which they are offering the education to the students, as well as research also goes on in those hospitals. And the second one is non-teaching hospitals. They are focusing primarily on just giving the patient care. Here the teaching is not included. The next classification is by the length of the stay. How long the patient has been staying in the hospital, based on that classification is done. Firstly, acute care hospitals providing short-term treatment, not for a longer period of time. They are serving and urgent conditions only are being treated in the acute care hospitals. And the next type is long-term care hospitals. Here they are offering extended care to the chronic illnesses, as well as rehabilitation process also is done in these kind of long-term care hospitals. So this was our fifth classification. And the final classification is based on the ownership type, where non-profit. Here there is no profit in the hospitals. They are reinvesting whatever profit they are getting in the facility for patient care as well as for services. And the next one is for-profit hospitals, where they are operating and general profit for stakeholders they are distributing. This classification also includes by the ownership. It's almost the same, but here public and private, but here non-profit hospitals and profit hospitals. So this was a simple classification of hospitals. Let's see what are the different functions of these hospitals. The first and the foremost function is the patient care. Patient care, they are providing diagnosis, treatment, and also for a wide range of health conditions they are giving the care. That is the first function. Coming to the second function is health promotion. They are educating the patients and communities for disease prevention and also for the healthy living. They are educating the patients, their family members, in order to make sure the disease is being prevented and they are living a healthy life. The next one is teaching and research. They are training. They are giving the training to the healthcare professionals and they are conducting the medical research in teaching hospitals. As I just mentioned you under the classification, they are educating the hospital doctors and also the nurses, whoever the professionals are, they are educating them. And the next function is emergency services. They are offering immediate care. As soon as a patient is in emergency, if they are coming to the hospital, they are giving immediate care for urgent as well as life-threatening situation. They are giving the care. That is also one of the most important functions of the hospital. The next function is rehabilitation. They are providing physical occupation. Obviously, they are giving the occupation to many of the people who are working in the hospital, and speech therapies for recovery from the illness or the injury. Obviously, they are giving that recovery and rehabilitation for the patients who are present in that hospitals. And the next one is public health support. It is also giving the aid wherein which it is controlling and preventing the public health issues and including the disease outbreaks. So they have a count of all the diseases which is spreading lately in these different months and the same month, and the outbreak of the diseases can be controlled with the help of this public health support. And the final function is the surgical services. They are performing the surgeries and related to medical procedures they are doing in order to give the care to the patient. So these are the important functions of the hospital. One of the most important question which can be asked for a 10 marker is the hospitals, its functions and the classification. Let's move on to our next important question, the care of the dying patient. How do we give the care for a patient who is almost at the end of his life? The first point under it is the physical comfort. Obviously, you are trying to give a good physical comfort, managing the pain and symptoms. And example, you can say breathlessness and nausea. You're treating the symptoms in order to give that person a physical comfort. So through the medications as well as the palliative care. The second care that you're giving is the emotional support. You're offering empathy and psychological support to that patient and their family members, wherein which you are addressing the fears and anxieties that they are having in their mind. So you're offering empathy as well as the psychological support. Coming to the next care is the spiritual care. You need to respect and also support the patient's spiritual or the religious beliefs he is having, and also you need to allow to do all his rituals and the end of life practices if he wants to do, because it's almost at the time of his death you're giving the care to him. So you should allow all his spiritual as well as the religious beliefs, allow him to do all his religious activities if he is wishing. The next care is communication. You need to keep a clear as well as compassionate talk, a honest communication with both patients as well as their family members about the patient's condition, and you need to make sure the goals what you have said, the care goals, that should be fulfilled. When you are communicating, you need to be quite clear about what you're communicating to the family and the patients. So the next care is dignity and respect. So here you need to ensure the patient is being treated with complete dignity and maintaining their comfort. Privacy should be maintained and personal preferences. If he is preferring some kind of care, personally if he is preferring, we need to give them comfort and personal preferences should be taken care when you're giving the care. The next type of care care is end of life planning. So what is this end of life planning? You need to assist with advanced directives. For example, if the patient does not want resuscitation, so you need to say do not resuscitate. You need to give these orders if the patient is not wishing for any kind of resuscitations. And decisions on life sustaining treatments, if he wants the life sustaining treatments or no, depending upon the patient's wish as well as the family of the patient's wish, you need to plan the end of life planning of care. Whatever care you're giving, end of life planning you need to do according to the wish of the patient as well as the family members. And the next care is the family involvement. As I just told you, providing emotional support and family members. To the family members, you need to give the emotional support, offering the guidance in the care decision. So how you're giving the care, the decisions should be made along with the family members and allowing them to time with the patient. It's just the end of their life. So you need to give some time for those family members to spend the time with the patient, and you need to allow them to take the decisions depending or related to the patient. And finally, the bereavement support. So you need to offer the family members the grief counseling should be given and emotional support to the family members before the patient death and also after the patient death. So these are the important care that we are giving to a patient who is almost towards the end of life. Next, let's move on to an important question, that is, what is pain? The different management of pain and also which are the different types of pain, which is one of the most important question for a 5-marker. Let's see what is pain. It's an unpleasant sensory and emotional experience. So you can sense the pain and also it is emotional. Sometimes if you have chronic pain, you feel like crying, you show your emotion. So that's what, it's a sensory and an emotional experience which is associated with the actual or the potential tissue damage. Why are you experiencing pain? Because you have certain kind of physical or emotional trauma. If there is wound, you feel like crying, you feel the pain. So that's what they are saying. They might be emotional. You can be actual or potential tissue damage, and hence only there is pain. So it's you can see it serves a protective mechanism. It is signaling the body to respond to the injury. It is just protective mechanism wherein which it is signaling our body due to any injury or due to any response. Our body is responding to that. Due to this injury, you are having the pain. So this is the simple definition for pain. It's an unpleasant sensory as well as the emotional experience which is usually associated with the actual or the potential tissue damage. So let's see what are the different management for the pain. How do you manage this pain? First point is pharmacological interventions. Obviously, you are giving certain medications, for example, NSAIDs, opioids and adjuvant analgesics which is helping in reducing the pain. That is the pharmacological intervention. Coming to the second one is non-pharmacological intervention, which is not including the drugs. Here, techniques like physical therapies, acupuncture therapies, massages, relaxation exercises, it also helps in reducing the pain and discomfort you are having. So these are non-pharmacological therapies, certain physical therapies, acupunctures, massages, and also the relaxation exercises. Coming to the third is the psychological support. Here, you are mentally giving support. Mental support is given with the help of cognitive behavioral therapy and mindfulness practices, which is helping us to cope, how to overcome this pain with the help of the psychological support. Coming to the next step of management is interventional procedures. So here they are blocking the nerve which is causing the pain to that person, and which area it is causing, they are trying to block the nerve. So once the nerve is being blocked, the pain sensations is not being sensed by that person. The pain is reduced. So nerve blocks, epidural injections and also other injections are given to relieve the pain, and that's called called as interventional procedures. And the final management is the patient education. So you are trying to inform the patient about the pain management, how to manage the pain, and the options and self-care strategies that he can adapt in order to reduce the pain. That is called as the patient education. Once you give them the education, why are they getting the pain and what are the strategies to overcome it, so it helps in reducing the pain. So let's move on to what are the different types of pain. There are different types. The first one is acute pain, wherein which there is sudden onset. You don't know, it just happens. Acute, that is sudden onset, typically sharp and short-lived. It doesn't stay for long, it lives for short, often due to injury or certain surgeries. You are having acute pain. Next is chronic pain. There is persistent pain. There is long-term pain lasting for longer than 3 months. It can result from ongoing conditions like arthritis and also fibromyalgia. This is certain kind of muscles are getting the pain. So these are chronic pain which stays for more than 3 months. And the next is the neuropathic pain. Neuropathic pain, it is caused by any kind of nerve damage or dysfunction in the nerve, and often it is described as burning or tingling sensation. You can see that tingling sensation or burning sensation due to the nerve damage or dysfunction. And the next type is nociceptive pain. It is resulting from tissue injury. Any tissue injury, including the somatic, that is along with the musculoskeletal and the visceral, the internal organs pain. Here musculoskeletal, internal organs as well as the tissue all are involved, and hence any injury to this, there is nociceptive pain. And the final type is the referred pain. The pain usually is felt in a location where there is no injury other than the source of the problem. For example, if they are having heart pain, it is usually felt towards the left shoulder. So basically the pain is in the heart, but you're feeling that pain in the other parts. So that's called as referred pain. So these are the different types of pain. What is the definition, management and types? It's a very important question for a 5 marker. Next, let's move on to our next important question, that is, what is enema? What are the classification and the purposes of enema? Enema, it's a medical procedure that is involving the introduction of the liquid into the rectum as well as the colon through the anus. It might be to the colon or to the rectum region. We are introducing the liquids, and typically to relieve the constipation. For the sake of relieving constipation, prepare for medical examinations, or also to deliver the medications to that area, we are giving the enema. Let's move on to the classification. Cleansing enema. The first one, it is designed to remove the feces or from the colon. So any kind of stool, if it is present, to remove that from the colon. Often it is used for patients who are having constipation or bowel preparation prior to any surgeries. We are giving cleansing enema. Second one is the retention enema. Liquid, it is held in the rectum for a longer duration under the retention enema in order to facilitate, increase the absorption to provide the treatment for that patient. The most told example is oil retention enema, which is one of the good example for retention enema. The third one is medicated enema. It contains the medication for local treatment of conditions such as ulcers, ulcerative colitis, or any kind of infections. They need to medicate that area, and hence, especially if there is ulcers in the colon and any infections, we are giving the medicated enema. So the next type is the barium enema. It's a diagnostic enema that uses the barium sulfate. So it is using this barium sulfate to make sure it is enhancing the imaging. When we are doing this x-rays of the intestine, it helps in visualizing these kind of intestines in a very good manner when we are giving this barium enema. The visualization is being enhanced with this barium enema. And the final type is nutritional enema. It is delivering the nutrients directly to the colon. In cases if the patient is having any specific situations like unable to eat, then we need to provide them nutrition, and hence we are giving the nutritional enema. These are the different classifications of enema, and let's see what are the purposes. Firstly, to relieve the constipation. If the patient is having constipation, it helps in softening the stool and stimulating the bowel movements, and hence the stool is being excreted. The next one is bowel preparation. When we are preparing the intestines for any kind of medical examinations or for the colonoscopy, if there is any injury or any, if there is any problems with the colon, we are doing colonoscopy in order to preparing the bowel, and hence this is also one of the purpose. And the next is medication administration. We are delivering the medications directly to the rectum as well as or for the colon. In some cases for the rectum and for some cases for the colon. For localized treatment, we are using it. And the next purpose is hydration. We are providing the hydration to patients who cannot take the fluids orally. So if the patient is unable to take the fluids orally, we are giving this kind of enemas for hydration. And the final purpose is diagnostic procedures. It is helping us in imaging studies by making sure we can see the bowels clearly and for better visibility. So these are the purposes of enema. So let's move on to our next question, that is the factors which are affecting the body temperature. So as we all know, body temperature keeps on increasing and decreasing as per the condition of that person. What are the different factors which is affecting our body temperature? First factor is the age. The newborns as well as the elderly people, they have less effective temperature regulation. Their body cannot regulate the temperature. They have less effective temperature regulation, and hence there is more fluctuations in the body temperature seen in the newborns and the elderly people. And the second factor, importantly, the time of the day. Usually our body temperature is lower in the morning and it will be higher in the evening times. And the next, the physical activity. When you're doing extreme exercises, your body temperature increases. The next factor is the hormonal changes. The menstruation cycle in the women, pregnancies in the women, and the menopause. It can usually increase sometimes or decrease the body temperature according to that women's body. And the next one is the illness or infection. Usually fever, it is elevating the temperature, while certain conditions, it may also decrease our body temperature. Due to illness or infections, the body temperature fluctuates. So the next factor is the environmental factors. So when a person is getting exposed to heat or cold, if he is exposed to heat, his body temperature increases. If he is exposed to extreme cold, then his body temperature slows down according to the environmental factors. And the next factor is hydration. If the person is dehydrated, then it is increasing his body temperature. This is also one of the main factor. And the next factor is clothing. If you are wearing layers of clothing, obviously your body temperature quite spikes or increases. And the next one is metabolic rate. If your metabolism is much higher, then there is more sure to increase the body temperature. As and when metabolism increases, it releases the heat. So your body temperature increases. So the final factor is the medication. For some drugs, example, the antipyretics and anesthetics, they usually try to decrease the body temperature, and it can also affect our temperature regulation of the body. So drugs usually, they alter the temperature regulations. Depending upon the drugs, some drugs they may increase and some drugs they may decrease. So these were the different important questions which might be appearing for your further exams. For such more important questions and topics, please further use and follow the Ezinurse app. So in the next session, we shall meet with much more interesting topics. Until then, bye-bye.